Hey, Nimbula, and a very warm greetings to you all, our dear listeners of the Talanoa with Dr. T program. While we are waiting for our guests today, just like to acknowledge the Oceania Pacific Health Association that is sponsoring this special webinar. And I've mentioned to our guests today that I will be playing some Pacific songs in order um, uh, for our listeners to join in and listen to some Pacific songs. Yeah, so that's something to kickstart our session today. And so I have a couple of songs that we will be listening to. So welcoming everybody who are joining in from all the different parts of the Pacific. Talofa Lava to our brothers and sisters from Samoa. Malo Elele for our families in Tonga. And Keorana to our brothers and sisters in the Cook Islands. Yaorana to those in French Polynesia, um, and then coming over to the Melanesian region, Halo Aloketa in the Solomon Islands, yeah, and bonjour to those in New Caledonia, Ali'i in Palau, yeah, Rananim, um, Yakwe. Wow, yeah, there's so many beautiful greetings. Uh, Kamna Meuri, and so many other warm Pacific greetings to everybody that will be joining in today. Yeah. So to kickstart our session today, as I said, there are a number of Pacific songs that I will be playing to allow us to wait for everybody else to join in. And this session will be in English. I will be speaking in English so that our guests from all over the Pacific can be able to benefit from this session today. So let's travel over to Samoa and listen to this song, Samoa Le Penina Oe. And I'm sure we will all enjoy it. Talofa lava to everybody joining in from Samoa or from Samoa, but listening in from the different cities around the world.
Say I
Beautiful. Talofa, talofa lava to our brothers and sisters in Samoa. What a beautiful, beautiful song that we've just listened to. And there's so many choices, I'm sure, with the talent that we have in Samoa. But I've been going through a song list that I have, and that was the one that I saw with the images of Samoa, and I'm sure that everyone who have been to Samoa or who are from Samoa and living outside of Samoa will really enjoy that, particularly looking at some of those beautiful images there in Apia. Vinaka Vakaleo Fafitai, Telelava, for joining in today. Yeah? Okay, so from Samoa, we will travel across to Tonga, and then we will maybe try and include Hawaii somewhere there, and then we will end with Fiji, and hopefully by the time our guest will be here today, to share with us their knowledge, and all of them are medical doctors, and they're qualified in the field that they're in, particularly the specialty in the field of gynecology, and also to do with women's health. And the topic that we'll be talking about today, we'll be looking at, you know, the topic of menopause and other medical topics that's related to women, and also looking at aging with a more positive perspective. Yeah, that's something that all the doctors that will be talking today will be sharing, yeah, with all of us. So the doctors that we will be listening to are Dr. Mike Berling, Dr. Temelesi Rasoki Windast, Dr. Lisa Ward, and Dr. Luke Aaron. So Aaron Campbell. Yeah, that's the name that I have. So, and all of them have specialities, which I will also read out their bio as well after the songs that we'll be listening into today. And yeah, what a wonderful opportunity for us, and it's a blessing, yeah, that we can have all these doctors who are specialized in their own field of research and their own field of work and study. And here they are today sharing their knowledge with us freely. Yeah. And the main aim of their organization, which they represent, which is Oceania Pacific Health Association, is to share this knowledge and the information about women's health, all throughout the Pacific. And so I'm really moved and touched as well today that that they've selected my platform for them to be able to use it as a platform to share with everyone the information that is really, really important there, that we all need to to know and to learn from. Yeah, and maybe that can also be a way that we can be able to save lives too. Okay. All right. So let's travel over to the Kingdom of Tonga. Okay, so let's travel to the Kingdom of Tonga. And the Tongans, too, their talents of songs, it was really difficult to choose. So we decided to choose the Mate Ma'a Tonga song. Yeah, I know many of us have been celebrating and enjoying the talent of our Tongan rugby players, yeah, especially in the rugby league field. So let us listen to Mate Ma'a Tonga. Malolele, everyone.
Atonga hiki tue tue, ahoe ni ahoe whankatete. He kuolangi taua hono whinangalo, he matema atonga ki holoto. Hey! Hey! Matema atonga, hey! Matema atonga, hey! Matema atonga, hey! Hey! Matema atonga, hey! Matema atonga, hey! Matema atonga, hey! Hey, matema atonga hiki tue tue, ahoe ni ahoe whakatete. He kuolangi taua hono whinangalo, he matema atonga ki holoto. Matema atonga hiki tue tue, ahoe ni ahoe whakatete. He kuolangi taua hono whinangalo, he matema atonga ki holoto. Noki noki, ko aie, ko au pe ise ko ai mate, matonga, oua, taululu, o whakamalo, mate ma atonga, hono whirangalo, asiene o wha, au fuato o lave ai asie tau no fo, mate ma atonga, hiki tue tue, whakatete. He kuolangi taua hono whinangalo, he matema atonga ki holoto. Matema atonga, hey! Matema atonga, hey! Matema atonga, hey! Hey! Matema atonga hiki tue tue, ahoe ni ahoe whakatete. He kuolangi taua hono whinangalo, he matema atonga ki holoto. Noki noki, ko aie, ko au pe ise ko ai mate, matonga, oua, o kanga tama hopo tupu I he laini, manga ki mua I kai ha holo mui, laiki ai ongo, tapa I laini, kau mua koe ki he wani, matema atonga hiki tue tue, ahoe ni ahoe whakatete. He kuolangi taua hono whinangalo, he matema atonga ki holoto. Matema atonga, hey! Matema atonga, hey! Matema atonga, hey! Hey! Matema atonga hiki tue tue, ahoe ni ahoe whakatete. He kuolangi taua hono whinangalo, he matema atonga ki holoto. He noki noki, ko aie, ko au pe
mate matonga. Malo pito for that beautiful song. And here we are traveling all across the Pacific, and hope wherever you are listening in from, you are enjoying this music that we have been enjoying thus far. Mula Mula Binaka, and if you are listening in live, you can also mention on the live where you are connecting in from. Yeah, so that'll be really, really lovely. Um, so we are just waiting for our guests to join in. Binaka, binaka, baka level. Okay, so oops. Nimbula, Nimbula, binaka. Thank you so much, everybody, for listening in today and taking time away from your busy schedule to be here with me. And I really, really appreciate it. Okay. So, and share this live as wide as possible to your network, because the information that will be shared by our medical doctors will be very, very vital and important for all of us. All right. Mm. Nimbula binaka. Nakabakalevo for joining in today. We are just waiting for our guests to join us online. Okay. Mm, all right. Nimbula binaka, nakabakalev sarana bakaronga tikumai, and I hope that you can hear me okay from where you are listening in from. Wakambula to everyone, acknowledging the Oceania Pacific Health Association, who are sponsoring this Talanoa session. As you can see that I'm not speaking in my Fijian language. I'm speaking in English because I am acknowledging our brothers and sisters from the rest of the Pacific that will be benefiting from this Talanoa program. Really acknowledging everybody who are logging in today. If you can please message or put let me know where you're logging in from, the city or the country that you're logging in from. That'll be really great. And just to mention the names of the doctors that will be speaking today, they are Dr. Mike Burling, Dr. Temelesi Windust, Dr. Lisa Ward, and Dr. Luke Campbell. And all of these doctors have affiliations and connections to the Pacific. They will be introduced today So we'll get to know their cultural or heritage side as well as the medical profession. And also, okay, they will be, okay. Okay, bula bula everybody. All right, so let's. Okay. Bula bula binaka. Thank you so much for joining in today. I know we'll also have some of our sisters connecting in from Europe, from Germany, from France, from England, and also from the Middle East. So if you're one of them, very warm greetings to you. Okay, just waiting for them to enter the Zoom room. And, okay, so while we're waiting for them to enter the room, I will take us over to Fiji, and hopefully we can enjoy this song from Fiji. It is a song by Tumbuna Veseaki, Land of the Mbula Smile. So hopefully that can be a wonderful song to take us over to beautiful islands of Fiji.
Producing.
All right, so let us travel over to Fiji now. Nimbula, Nimbula Vinaka. And hopefully you will enjoy this song.
One love, one heart. Duy kay kay, how many batamay, united in diversity. Fiji, my island paradise, land of the moon smile. They say the way the world should be. Islands in the sun, one love, one heart. We can find how many but the mind, united in diversity. Let's rebuild our island home with true racial harmony, diverse cultures in a unity. Yeah, Fiji can lead us off the sea. Together is prosperity. My island paradise, land of the moon smile. We see the way the world should be. Islands in the sun, one love, one heart. We take time, how money but the mind. United in diversity.
Pacific music.
Come together.
The lady that's doing
Despite our differences, Mubata Bilamani, Namula Sawi, Inumukanu, Anongubanua, Aganatuenai, Mendua Vitivo. Fiji, my island paradise, land of the moon smile. They see the way the world should be. Islands in the sun, one love, one heart. We take time, how money but the mind. United in diversity.
I need to it's gonna go live.
My island paradise, land of the moon smile. See the
Hold
way the world should be.
breath out, and hold breath out. 2, 3, breath in. Breath
All
out.
right. Vinaka Vinaka Wakale, what a beautiful song from Tubuna Veseyaki. And it's been awesome couple of minutes that we've been here waiting for our guests to arrive and traveling over to the beautiful islands of Samoa and also to the Kingdom of Tonga. And just the last song taken us to beautiful places. And yes, it's making me homesick, and I wish I'm there right now. But never mind, I'll be there soon. So on that note, I just wanted to acknowledge our guests who are here, and we are so blessed to have them taking their time out from their very schedules. As we all know, they're all medical doctors, and here they are representing their organization, which is the Oceania Pacific Health Association. And the aim of the association is to share their medical knowledge to everyone out there in the Pacific. And we're so blessed that they're here and we can be able to share a little bit more of what they will be sharing with us in terms of women's health in general, as well as the topic of menopause, and also, talking about aging, but aging in a very positive light. And I think that's how I felt when I was talking to Dr. Tema, talking about aging. Most of the time it's always, not the other way, not the positive way. We're looking at the pain and we look at this and that, and why is this happening to me? But the way I was talking to Tema, it's sort of like, come on, let's accept it, let's enjoy it, and go on this wonderful journey of aging gracefully. And when you look at them right now, I'm looking at them on the screen, they all look so amazing. So, Bulavinaka to you, Dr. Tema, to all of our beautiful doctors. So, Dr. Tema, if you'd like to say a few words and also welcome our other guests who are joining in today. Vinaka.
Naka, Dr. Tarisi, Bulavinaka, everyone. Tala Falava, Malolele, Kia ora, kia orana. Good day from Australia, and warm Pacific greetings to everyone across the world, and the Pacific and the world. And we're welcoming you all the way from Mount Gambier, which is a little town in South Australia. And to my left, I do have a colleague. This is Dr. Luke Ward. And look, did I just say Luke Ward? I'm sorry. I will let Dr. Luke introduce himself.
Hey everybody, sorry I don't know your native tongue. My name's Luke Campbell. I work with Tema here over in Mount Gambier. So lovely to join in.
Luke Ward is actually Lisa's husband. But anyway, Bulavinaka, everyone. I am a specialist obstetrician gynecologist based here in Mount Gambier, and my everyday work involves this very topical subject of menopause and women's health, perimenopausal health. So thank you, Dr. T, for bringing this platform to life and giving us the opportunity to stand here rather in front of you all and deliver this message, which I think is very topical. I also would like to introduce Dr. Lisa Ward. Lisa is our endocrinologist. She is a specialist based in Queensland. She is currently living and working in Gold Coast. Lisa, we are very honored to have you here, share your experience, and also talk about the work that you do with regards to endocrinology, hormones, and women's health. So, vinaka vakalevu Lisa for coming. And I'll let Lisa say hello.
Hi, thanks for having me join along. You can hear me okay?
Yeah.
Great. Yes, as she mentioned, actually my name is Ward, so it was a bit of a double take, but my background is that I'm Tongan and Filipino. I reside at Gold Coast in Australia, and I'm in practice here doing I do both endocrine publicly and privately. And yes, I do cover this topic quite a fair bit as well, with perimenopause and menopause. So thanks for having me on board.
Thank you, Lisa. We also have Dr. Quinileti Chen, who is the current president for Oceania Pacific Health Association. She will be joining us at some point later during this talk. She's currently holding a clinic, which I think is probably coming towards the end of her clinic. But when she does pop in, I will introduce her at some point. And we also have the greatest privilege and honor to have Dr. Mike Burling, who is our gynecologist. Mike is he is a Pacific specialist that is originally from Tonga, and he specializes in cancer in women and is based in Sydney. Mike is currently operating, so when he finishes from his surgery, he will join in at some point, and we're very honored to have him to have some questions relating to cancer in women-related issues later in the talk. Naka.
Dr. Tema. Thank you, Dr. Luke, and thank you, Dr. Lisa, for being here with us today. We're all excited. We have so many of our women messaging me. Some will be joining in from Germany, from France, and even from the UK. And I've got a few who are logging in as well from the Middle East. So it's really great that the word has been, shared. That this session is going to be taking place today, and also, of course, from the Pacific too. From Fiji, there's a few joining in too, and from Australia and New Zealand. So, Dr. Tema, the floor is yours with your presentation.
Thank you. Dr. T, would you be able to allow me to share the screen?
Yes, I've activated it. Yes, you can.
Oh, okay.
Yeah. And for those of you who are watching as well, while Dr. Tema is ready with the presentation, you're welcome to ask questions. So if there are questions that you want to ask, you can type it on the chat, and I will be happy to read it out for you. So don't be shy. And I hope that our doctors, this will be the first of many. If there are follow-up questions, we'll definitely aim to do something again next month or the following.
Naka. Dr. T, can I confirm that you can see my screen? Okay.
Yes.
All right, let's get down to business. We only have an hour, so just to warn the viewers, some of us are called away to meetings and also to see patients after. But we are going to run this session into segments. As you can see, there are 4 speakers on today's show. I will introduce the team. I'll start off by talking about menopause and some of the understanding behind menopause, the different definitions that we use clinically. And I'll run the talk for 10 minutes. I will stop and have the floor open for some quick questions before we move on to the next segment, whereby Dr. Ward, Alyssa Ward, will talk about hormones and the endocrinology behind hormones in menopause, just to get you an understanding of what it is all about. And then we will come towards the treatment phase, whereby I will go back into the treatment. I'll talk about how we would normally manage women who come in with perimenopause, menopause, and some of the postmenopausal issues. And we will then have Dr. Luke, who will talk about some of the adjuncts, lifestyle modification adjuncts to treatment of menopause and menopausal symptoms in women. And towards the end of the talk, we will have Dr. Mike, who will talk about cancer-related issues with women in this particular age group. Okay. So just from a disclosure point of view, as I've already mentioned at the first part of this discussion, I wear 2 hats aside from the talks that I do for patient education, one of which is the specialist role here in Limestone Coast Health District Network, and the other is being a board director for Oceania Pacific Health Association. So my message today may not necessarily reflect the issues surrounding what I do generally every day from work. It is all my personal views on what I think is to do with menopause, and I hope that does clarify the disclosure or conflict of interest point of view. So just from a general point of view, most of the talk is broad, and it's also inclusive towards how we would generally approach women with in women's health. I would be using a lot of these 2 terminologies in my talk, women's and girls, and it doesn't mean that this is only inclusive to women and girls. I am aware and also acknowledging the fact that these terms can also be used diversely, particularly in our gender-based and biased inclusive world that we live in today. And we want to make this as inclusive as possible. And if some of the words or terminologies that we use is uncomfortable in your context or in your cultural background context, feel free to let us know, and we can try and modify that. So moving on, I think it's important for us women to understand that menopause is not a medical issue. Happy if you just start the timer so I can keep track. Yeah, it's not it's a physiological process. It's a normal human process. It is something that we don't talk about because we feel that it's a huge taboo. Sometimes we push it towards the side and we talk about it in secret because it is such a sensitive topic, but this is just part of our normal process, and as you rightfully said, Dr. T, this is something we should be embracing because this is a really important journey in our everyday life, particularly in our lives as girls and women. So menopause is actually in 3 different stages. There is the perimenopausal phase leading up to menopause, and then the menopause phase, and then we have the postmenopausal phase. So the perimenopausal, in very simple terms, as we are born as women, we are blessed to have 2 sets of ovaries with millions and millions of eggs. And as we reach the reproductive phase where we reach adolescence, the number of eggs gets reduced, almost cut into half. And then as we age day by day, the number of eggs reduce. And then we get to a point where we slowly start run out of eggs, as how I would call it in layman terms. And that is the perimenopausal phase. Once we hit the phase where there's no more eggs available to secrete the hormones that we need every day for our basic function, which is estrogen, we hit menopause. And then 1 year out of menopause, where we've had the final menses and no further menses for more than a year, we call that the postmenopausal period. So what is menopause? There is no definition, but the general consensus is that it is the final or the last straw or the last period. As I've said before, it's a natural process, and some women, they can go through the natural process, but there are a few other women who may have had surgeries earlier on in their life for other medical reasons, where they have their ovaries removed, and they have, or what we call induced or surgical menopause. Menopause can also occur if someone has had chemotherapy or some form of stressor where it stops the functioning of the ovary. As I've said before, there is no definitive test to test for someone who is perimenopausal or menopausal. But one thing we know for sure is that we use symptoms as a guide. And often we have women come into clinic to ask about, is there any blood test, or do we use saliva or anything of that nature to tell that I have menopause or not? And our general advice is there's no right or wrong answer. We base it on your symptoms. But once you've had no periods for 12 months, 1 year out, is when you hit your postmenopausal phase. And this is an important, clear distinction because the treatment for us varies on how we get the definitions. Now, when does menopause occur? Most women here in Australia, the average age at which menopause occurs is 51, but it can range, as I've said, between 6 to 9 years. Some have it earlier at 45, and some can have it at 55. If women hit menopause, meaning no periods at all, and they have the other symptoms of menopause at less than 40, then that is classified as abnormal, and it needs to be investigated further. And for those women who are under 40 and have symptoms of menopause, which we will talk about later, you need to seek medical help. You need to go and see a local doctor near you. So what are some of the menopausal symptoms? They can range. The menopausal symptoms that most commonly women present with is hot flushes. And we call this in medical terms vasomotor symptoms. And some of these hot flushes can be very debilitating. They are unable to cope with everyday hot flushes. Sometimes dryness in the vagina, migraines, aches and pains, sleep disturbances, mood disturbances. They have problems with their bladder. They retain weight. They sometimes can experience crawling or itchy skin. And often always with the associated mood swings, these women can have irritability and just less focus, less concentration, and what we call less anhedonia or less interest in sex, or their libido level goes down. And these are some of the physiological processes that occurs behind someone who is undergoing the process of menopause. Now, I will pause here and I will ask Dr. Ward to take over. And explain some of the hormones and associated with menopause and some of the physiology behind it.
Okay, great. Thank you. All right, so I will sort of talk a little bit about what you have covered because I find it really fascinating that women and girls are actually born with their full complement of follicles, and inside that, the eggs as a baby. And as you said, there's millions. And actually the whole apparatus or the whole system comes, and it's not yet completely developed. And then that's the component of puberty. And then with puberty, actually, you have a controlling system that comes, and it's actually in the center of your brain, and it controls how your hormones may come from your ovary. It gives it a signal. There are pubertal signals that say to the ovaries, now it's your time to sort of start creating some hormones that are important that come from the ovaries and continue the development of the reproductive tract. That whole tract is not only the ovaries themselves, but your womb and then the tubes that connect. So actually, as you start developing in puberty, some it may be younger than some, like, usually around about 10, you're starting to see signs of development. And then actually, if the general age is that you have your first period at 13, that is actually the end of that pubertal development for a woman. So that means that whole tract is now ready, in a sense, to be fertilized. But don't tell the 13-year-olds that. And in some cultures, actually, your very first period is celebrated. So say I have both a Tongan side and a Filipino side, and actually both cultures do celebrate this. And it, as a teen, it is a very embarrassing thing, but that's essentially what it's heralding, is that a coming of age step. So some cultures may talk about 18 or 16 or 21. So there's different parts in different cultures. So this is just one of them. So now the tract is essentially developed, and you have a cycle of hormones. So that's your estrogen, your progesterone, that will be there. They have a peak and a surge, and they settle down. And for some people, or most, it might be regular, and some people it might be irregular. So that's how it goes through their adulthood. And menopause is like the opposite to this component, where the ovaries are winding down, and so they've found this age point where they can no longer produce these hormones anymore. So then what used to be regular, so say it was every 28 days or every 30 days you had a period, it might be kind of like a car that starts to sometimes get there, sometimes not, but it might be a bit longer, it might be actually shorter, it might be heavier. So those are the early signs of perimenopause. And some people might even have thought that you might have heard it, some of the other women, they've said, oh, I thought that I was done. I had 3 months of nothing, and then I had the heaviest period ever. And that's what I say. It's like the ovaries giving a last hurrah, where it was regular, it's become gaps in between, and then suddenly, and then there isn't any. However, the whole thing of that is that you can only really say it's menopause. We've created a term to call the end of it, where we say there's been no periods for 12 months. So actually, there is no actual event to say, congrats, you got through this. But we can only say, oh, look, that probably was my last period back then. Yes, and as Tema said, that this process is natural. It's interesting because it is different for guys, where you would still continue to produce, the opposite to eggs would be sperm, but they would continue to produce semen. So that actually you can still have babies for a man at 70 years of age, but that's generally around about 70 or thereabouts, where you start to get that decline in the production. But for women, it's like you're born with a full complement, and then the complement from there, they have ovulation, and then that sort of ending time around that 45 to 50, 55, but I would say most 51 to 52. And then in turn, it's like, oh, I guess another question would be like, why can't we have a baby then at 50? It's mainly because can the rest of the whole reproductive tract handle it? And so you will see like that's only like a short component of it. Like you may have an egg, but then, thinking of the egg cartons that you have in your fridge, like it's not the same fresh eggs that you had when you bought it from the store 3 weeks ago. So they do degrade in quality too. So then that's why you may not be as fertile in that 40 to 50s compared to your 30 to 40s. And then they always talk about being your most fertile. What would you say, Dr. Tema, in your like 18 to mid 20s, which is when no one really wants to have children at that time, but it is what it is. Right. So that's what I thought I would describe. It's kind of like the opposite menopause is to menarche. And then there is actually many different types of estrogen and progesterone components that we can measure. But we mainly measure estradiol in labs, and we use those other markers that I mentioned that come from the controlling gland, the pituitary. Those ones are your FSH and LH. but they're not so much a big part to it. It's mainly focusing on the ovary, and can the ovary still do its job? Okay, so what are the end effects of not having this hormone anymore? So the main thing that perimenopause or menopause, how it will present in women that we'll commonly see is they get these hot flushes. And we call that vasomotor symptoms. So that might be part of it. And then if you ask them a couple of questions, they might say, actually, I didn't know if how I've been feeling also relates to it. Sometimes they describe the feelings of their worth and how they don't feel like up to the same steam that they used to in the same job. The job didn't change, the duties didn't change, but they don't have that same steam, or even their self-esteem or their confidence, sometimes anxiety, and they can't really marry everything together because they thought it might just be a component of just their mental health or their mental status at the time. Or so it kind of comes into part of that. So I usually say there is a helpful scale for us to look at the symptoms because they're really, really quite broad. But I try to lump it into vasomotor. That's the flushes, so the feeling of hot, which I would say at least half, maybe 60 to 70% get. And then the emotional component, sometimes it's like some describe it as a worthlessness. The other part is the urogyne symptoms, which is like local vaginal symptoms, but also can be related to libido. Somatic symptoms, which is actually like your joints, like sounds fantastic, doesn't it? But so aches and pains in your joints. I'm really selling it, am I? And then the other component that I will commonly see as an endocrinologist is if actually estrogen was very critical for its effect on bone and muscle, but particularly bone we can kind of measure, muscle a little bit harder to do. But we find that losing your estrogen, particularly if we lose it a little bit early, accelerates your bone loss. So essentially, it's very different for someone going through menopause at a normal time, 50-ish, if you got it at 30, for example. So they just have, because there's that sort of a decline in your bone health, you just don't want something to happen earlier, like a decade or two earlier. So that's the component that I do see. So mainly the flushes and the bone health. All right. I think in turn, like hormones that, I've talked about hormones that we can measure. What do I look at? The effects that I look at. I glossed over one other symptom component is that the metabolic effect. I would say probably I usually have to dig around to sort of describe that effect usually. So someone doesn't usually just come in and say, this and this has happened. I usually might check their cholesterol levels. Their cholesterol levels might be different to what they usually are. Later down the track, maybe months to years later down the track, they might say, I find it really difficult to not gain weight or to keep the weight off the middle. And that's a common complaint. And it can be related to how we have less estrogen and how it makes you more likely to be insulin resistant and difficult to lose weight, particularly around the middle. Not saying that HRT definitely changes these things, but it's part of the symptoms that we can see that that's why menopause gets a bit complicated, because initially, what are we trying to do about it? If it is natural, I need to see like what is troubling you about it, and what do I think that we should also fix too. So that's my thoughts. Any other thoughts that you thought, Tama's youth? Oh, you're on mute.
Thank you, Lisa. That was a really good talk, and it's nice to understand a little bit of physiology behind the hormones and, your strengths and your cup of tea every day with dealing with hormones from an endocrine point of view. So that's very informative. I will pause here for a sec. We are heading down towards management, and some of the things we would normally do or recommend for treatment of menopause. But before I do so, I'm just looking at the time, and perhaps maybe if I could suggest we change our webinar just ever so slightly to the point where I think we should just run through the whole talk, so we don't have much more to go. And then a lot of this would be question and answer session, which is going to chew up a lot more time and give our viewers an opportunity to really ask questions. Would that be okay with everyone? Okay. So moving on to management. I don't know if we can. Here we go. Yeah, this is okay. So we've had so much talk about hormones, the different hormones, the aging, the natural process, what goes on behind menopause, how does menopause come about, the average age of menopause here in Australia. We don't have the statistics for us Pacific Islanders and those around the world because of the fact that we don't have enough awareness and we haven't done enough studies to get our baseline statistics. So with that being said, because of the natural process, at the point at which Lisa was talking about, the main hormone that is responsible for most, or if not all, of the menopausal symptoms is estrogen. And estrogen is one of the main hormones that's produced by the ovaries. Unfortunately, as I've said before in the opening part of my slide, as the egg level goes down to almost zero, what happens is there's hardly any more estrogen left. And so with that, the mainstay of treatment is usually either medical, non-medical, or you could offer all of these lifestyle management options. And I believe strongly that there is a big role in a combined form of approach towards treatment of menopause, and it cannot be medical only, because some of the treatments that we offer where we replace estrogen comes with its own risk, and I'll talk about that in the next slide or two. But some of the things that we do offer is lifestyle changes, regular exercise, getting yourself into a diet where it is going to benefit you from replacing those natural estrogens. We call that phytoestrogens. And there's a separate talk on that altogether, which is quite extensive. There's a big list of natural products or natural food that has some degree of phytoestrogen that can be helpful. Some women do use it and they find relief in their symptoms. There's still not enough evidence that that should be the first line treatment, but if it plays a role in relieving symptoms, I strongly believe that it is a role in also part of the combined care package towards women who have all of these symptoms. The other treatment option that we also offer are menopausal hormonal therapy. In the past, we used to call it HRT or hormonal replacement therapy, but they have now changed terminology to MHT. In my mind, it makes no difference whatsoever, but the same rule applies. What we are trying to do is to replace your estrogen level to what it was premenopausal. So these treatment can come in many different forms, can come in patches, can come in tablets, it can come in gels, it can come in pessaries, and there's so many different types that's out there in the market. But before you are starting one, it's very important that you need to seek medical help and get it prescribed by a doctor who will discuss with you the pros and cons of taking MHT or HRT before you actually start it. And then we also have the option of complementary therapies. So some of the things that I tell women as part of managing your menopausal symptoms at home or perimenopausal symptoms is avoid taking too much spicy food, because that can upset your natural phytoestrogens. Avoid taking too much alcohol and caffeine, particularly at night, and that's some of the aggravating factors for lack of sleep at night. Now, avoid smoking and make sure that your diet is nutritious. Include, as I've already said, food with phytoestrogens and exercising regularly. Now, before I get into exercise, I am a big advocate for weight-bearing exercises in women who are getting closer to their perimenopause and menopausal age group. And the reason being is As you age and as you get towards your perimenopausal, menopausal state in life, your levels of estrogen, as I've repeatedly said, decreases. It has a huge impact towards your bone and your bone density. And women often, in their menopausal state, often come up with conditions such as osteoporosis. The only way you can build that up is to ensure that you've got diet that's helping you with your bone function, as well as doing weight-bearing exercises that will help develop your bone strength. And this will prevent you from getting osteoporosis and other associated conditions with bone health later in life. And excessive heat. I mean, this is a no-brainer. If you are in a hot climate, make sure you're surrounding yourself in somewhere cooler, because the menopausal hot flushes is very troublesome for some. So with the HRT or the MHT, the most effective treatment, this is the most effective treatment for healthy women. When I say healthy women, it means women that we have no contraindication, in giving them the HRT or the MHT treatment. It comes, as I've said, it comes in different forms, and the forms are all out there, but you need to make sure that you talk to your GP or your doctor to ensure that you have been excluded for things like blood clots, breast cancer, and gallstones, and all the other associated conditions, which puts you at risk if you do take them on a much longer basis. There's also an available preparation of vaginal estrogen that's out there in the market. We routinely prescribe it for our women, and it's called Ovestin cream or estriol pessaries. These preparations is safe, and we've just had the latest evidence to say that this is also safe for those women who have breast cancer and those who have history of venous thromboembolism or clots in the legs, rather. So it does not increase their risk further, because it's topical and the absorption into the body is much lower. Moving on. With the oral preparations, the gel preparations, and the others that have a higher metabolic intake, we wouldn't recommend this for those who've had breast cancer or have had previous breast cancer, have underlying endometrial cancer, or are at higher risk of having endometrial cancer. So as I've said repeatedly, if you do have any of these conditions, talk to a doctor before you consider taking any hormonal replacement therapy or MHT. The other options that's also available that do not contain hormones from a medical point of view are some of the things that we would prescribe for women who have blood pressure issues, such as clonidine. They can come in patches. The efficacy is not as high as replacing estrogen with estrogen, but they do play a role, and there is some really alleviation of symptoms for some of these women. There is also what we call SSRI or SNRIs. These are drugs that are prescribed routinely for treatment of epilepsy or anti-epileptic drugs in the market, but they do have a role for treatment of menopause-related symptoms, particularly hot flushes or vasomotor symptoms in these women. I talked about the vaginal lubricants that's available out there. We also have these options. They can come in a hormonal or non-hormonal form. And in those women who have severe vaginal dryness, a short course of hormonal replacement therapy can also be considered for some of these women. Just out of interest, for those who might be interested, particularly the medical viewers that are listening in, Australia is launching a new alternative to vaginal estrogen. That's coming out in the market. It has a 90% efficacy in managing the women with severe vaginal dryness, and it has a lesser side effect in terms of what vaginal estrogen used to do, but at the moment it's not subsidized, so you'll still have to pay a fair price for that. Right, I'm going to pause here and I'll hand over the mic to Luke. Dr. Luke Campbell is going to go through some of the complementary therapies that we offer. And if you are sitting in your lunch, please, he might get you out of your seat and you might do some of these complementary therapies as a practice.
Thanks, Tema. So my name's Luke Campbell. It's such a privilege to be invited to come on today's webinar. I work as a medical doctor, but I have a very huge interest interest in preventative medicine as well as integrated medicine. So I'm also trained as a remedial massage therapist, a yoga instructor, for which I specialize in yin yoga. And I've started studying in the fields of Chinese medicine and looking to go into acupuncture as well. But before I kind of touch on a few different complementary therapies, including CBT or cognitive-based therapy and acupuncture, how about we all just take a moment to look at our breaths? So feel free just to take a seated position where you are. Feel free to close down your eyes. And if it feels okay, there's also the option to lay on the ground. But just notice. So just take the time here to feel what you feel. How is your body feeling right now? Perhaps just scanning the body from head to toe. Where is it in your body you're holding any tension? What are the thoughts that are coming into your mind right now? Perhaps coming to tonight's webinar was a bit of a rush. Perhaps today was a stressful day. Now just take notice of that breath. Not trying to change, but just notice. Notice how you're breathing. How is the air coming inside your body? Is it through the nose? Through your mouth? Perhaps noticing the effort of the breath. Is it easy? Is it a struggle to allow the air to come in? Is your breath shallow or is it fast? What parts of your body are moving when you breathe? The breath is one of the first things that you do to come into this physical world. That nice first inhale. And it's the last thing that you do before you leave this physical world. Your breath stays with you for your whole life. Just noticing the sensations of the breath, the temperature of the air you breathe in, the passage it flows. If you are laying on the floor, feel free to place one hand on your chest and one hand on your belly, or even in the seated position. Just notice if you increase that inhalation, a nice deep inhale. Notice the hand on the belly to rise, and perhaps feeling the chest rise. Deep breathing can help focus our mind. There's lots of studies showing that it helps with anxiety. Focus now on every inhale being deeper and longer than the one before, really allowing your belly to expand, the chest to expand. Notice how your body's feeling right now. What's going on in your mind? And using every exhale as an invitation to let go, release any tension. Taking a nice deep inhale here, expanding the belly, opening the chest, and let all of that go on an exhale. Feel free to slowly open those eyes. There's so many amazing different breathing techniques that we can use. One of them that I think is so simple, and it's something you can do yourself, do anywhere, but also provide education with your patients and people that you see in clinics, is breath holding. So if you were to take just a simple breath in and a breath out, and at the end of a breath out, you're going to hold your nose and then count to a few seconds and then let it go and breathe normal. And you can do those as a few cycles. So if we were to give that a go now, so just taking a normal breath in and letting that go on a breath out, and then holding the nose, 2, 3, 4, and then normal breathing, letting go of the nose, just having a few cycles of normal breath in between. And then once again, normal breath in, normal breath out. And on the end of that exhalation, holding the nose, counting for 2, 3, 4, and then releasing and normal breathing. And you'll find with time, the ability to hold your breath after an exhale will increase. And you'll just notice the changes in your body over time. This is just one of many examples of some breathing techniques. So if we were to look into some different modalities, so CBT, a type of psychotherapy, and it really looks at the relationship between your thoughts, feelings, and behaviors. They've shown lots of benefits in the menopause and perimenopausal period. In particular, it can help with the managing of the vasomotor symptoms that Dr. Tema and Dr. Lisa talked about before, so with hot flushes and night sweats. There's also evidence showing that CBT therapy, that psychotherapy, can help with anxiety and stress, and in particular, identifying and managing the negative thoughts that might be around going through this period of life. And as Dr. Tema mentioned, it's just a natural progression of life. Sometimes when we have changes in our life, our natural response as human beings is to challenge them or to think negatively around those ways. So CBT can be a great way of just exploring and looking at your connection between those thoughts and behaviors. And the other great benefit of CBT can be improving your sleep. Another modality for some people is acupuncture. So acupuncture exists in the world of traditional Chinese medicine. It looks a lot about the mind and the body, as well as your environment. So they say with the role of the body is really to anchor the mind, and the mind invigorates the body. And these two things can't be separated. So your body is going through great changes. So naturally, this may interrupt the mind and the mood, things like that. So some of the points with acupuncture, so it looks at channel systems in the body. So one of them I can show you on your wrist first is, so if you got the inside of your wrist and the outside, so on the inside is the heart 6 acupressure point. And on the outside is the lung 9. So a simple method can just be using your thumb to massage along the wrist here. So the heart 6 can be great for night sweats, and the lateral side there. So in Chinese theory, the idea of menopause is when there's a slow decline in your yin and yang, also your essence and qi. Another point, sorry, I've not shaved my legs for today's talk, is on, I don't know if anyone can see here, is on the inside of the foot. So you have above the ankle bone here, which is the medial malleolus, if you do 4 fingers above and in the center, this is your spleen 6 point here. This is really good for strengthening and nourishing, and it's just a great point in women's health in general. Now, not relevant to the menopause area, but women of childbearing age or who are pregnant, this is actually contraindicated because it can induce labor. And the other part is the ankle bone just below it. You have here your kidney 6, and this is a great point for insomnia. So perhaps your loved one or a friend can give you a bit of a foot massage just before bed, things like this. Other areas that are great in complementary therapies is things like yoga and massage. So anecdotally, I've worked with lots of women who I think a combination of going through the menopause, the stress of their natural life, and just kind of finding the time to come in and to settle and to be. So things like yin yoga, which is a practice which is more relaxing, more spending time with yourself and going through some breathing exercise can be great. For those who have never had acupuncture before, I thought I'd show you some needles. I've got a helpful volunteer here, complimentary. So They're very tiny needles. There we go here. So they come in a little pack here. And for example, they're going inside. So I think if Tamara will use your arm. So we'll just go here. So if we use a point here, so I won't do a particular pressure point per se, but just to show the simplicity of how they work. So you have a little introducer just on the skin, and it's just straight in like this. So they're quite simple, very flimsy, and the pain's minimal. So there's also the idea of going to traditional Chinese medicine practitioner for individualized treatment, and they can look at what's going on in your life. Sometimes there's different herbs and things like this. But yeah, and to do with the cognitive-based therapy, there's different ways of providing this treatment. So it can be individualized with the therapist. There can be group sessions. There's also help books and online courses and things like this. Yeah, namaste.
Thank you, Luke. Oh, that was incredible. And so just moving on, I'm very conscious of time. We will now talk a little bit about postmenopausal health and some of the things to watch out for after you've reached your full 12 months, no periods, and now you're hitting your course of journey of embracing life and enjoying all of that knowledge and wealth of experience that you've experienced with your own individual journeys, just bringing us back to basics, reminding ourselves to ensure that we continue our good health. What we have done leading up to your course of menopause doesn't mean that you hit menopause, everything stops. Oh, I'm no longer worth it. You know, it is a natural process, and everything can still go on like what it was prior to menopause. Regular exercise, making sure you're getting your cardiovascular health checked regularly with your GP. You're getting your bone density checked. If it is short, you can take supplements or go for your weight-bearing exercises. Often with this change in hormones, it can redistribute your weight, and menopause does not cause weight gain. I will not say this enough, and I cannot re-emphasize that enough. It is because of the changes that's related to your hormones that does increase your hunger, and you can combat that by going through some of the techniques that what Luke was talking about, as well as the diet that's supplementary with phytoestrogens. Making sure you're checking your blood pressure regularly, your sugar checks, breast screens, cervical screening screen is up to date, and also doing your bowel screening. So we will now come to a point where I will check if Michael is if Dr. Mike Burling is on. I don't know. No, Michael's not here yet. I think he's still operating and is still in surgery, but that's okay. I will jump in on his behalf very briefly. When do you need to see a doctor when you're going through menopausal changes? When you are bleeding after 12 months. It's not normal to bleed after 12 months, even if it is the slightest spotting. It's the slightest spotting will indicate there is something going on. Go and see your doctor, go and get checked, go and get an ultrasound scan, go and get examined, and allow yourself to go through having a pap smear done, a biopsy done inside your uterus, if that is an indication, and get checked out to make sure we haven't missed anything, because there are pathology that is associated with this. And if you have problems with urination, if you are making it late on time to go to the bathroom, if you can't hold a wee for longer periods, if you're wetting yourself regularly, if you leak when you cough and sneeze, this is not normal, and you should probably go and see a GP or see a specialist so you can get treated. I will bring us to some of the useful resources we use here in Australia. This is a really good website. It's called genehales.org.au. They use very current evidence with regards to some of their fact sheets, their symptom check. There's good podcasts, videos, and articles available. And if you are able to download the symptom checklist, and if you feel you're ticking more than one or two in that checklist, perhaps it's time to go and visit your local local doctor or see a colleague. And this is another useful resource when it comes to menopause. And I'll leave it there in case you want to take a photo or if you'd like to download it yourself. But these are some of the websites we redirect you when you come to see us in the specialist clinic. The Australian Menopause Society has really good information with regards to menopause and some of the medical treatments that's available. We also have the Jean Hales Foundation. We also have some of the other different health networks that also provide some of their information. I'll pause here, and I can see that Dr. Letty Chen is online. I will quickly introduce Letty before we open the floor for a few questions before we close the session. Dr. Letty, are you there?
Yes, Tima, I'm here.
Would you like to introduce yourself to the group on behalf of OPA, please?
Okay, I'm having issues with my camera. Sorry, because I'm trying to zoom in from my phone, but it's not working. So.
Oh, that's okay. So on behalf of the group, I would like to introduce Dr. Letty Chen, who is the current president for Oceania Pacific Health. Thank you, Dr. Letty, for allowing us to use this platform together with Dr. Tairisi to disseminate this health message. I felt that the session today was exceptional in terms of coming together, collaborating between health and non-health topics, which is really pertinent and topical. And I will pause here and I'll hand over the mic to Tairisi for any questions for the floor.
Thank you so much. Vinaka vakalevu, papetai telelava, malo aukito, mahalo nui, and all those beautiful Pacific words that we want to say them all today. We've just been so blessed, if that's the best word to use today. And also maybe we'll say that the blessing for having all of you, here with us, with Dr. Letty Chen, for Dr. Lisa, Dr. Luke, and also for Dr. Tema. We are just, I'm just sitting here. I just couldn't believe that, this moment is here. We've been talking about it with Dr. Tema for a couple of weeks, and we're like, okay, we'll do this, we'll do that. And initially, I thought that Dr. Tema was only be here by herself. And little did I know she's going to bring the whole team with her. So from on all our behalf, Vinaka Vakalevu for sharing your knowledge with us so openly. So I'll open it up to the audience who have been going through the comments section. Safaira, anyone that is out there? I haven't seen any questions, but there's lots of hearts being thrown to us. Yeah, lots and lots of hearts. Maybe can I ask you just one question, if that's okay?
Sure.
Just one quick one, because I think it was when Dr. Lisa was speaking, and she was talking about the age of when can we have a baby at 50? Kind of looking at the age, because there are some that have babies like really late, and some who don't. Like, would any of you just elaborate on that? That was something that I wrote down that I wanted to ask about the age of still having babies after 50.
Lisa, do you want to go?
I'll speak to what I know, but I would say you might see a bit more so than I do. I would say that like women nowadays are having their babies a little later. It's just usually other sort of conflicting priorities that are happening. That's why they might have children later. But I would say that I find some are having babies at mid 30s, but usually if it is over 40s, there is some assistance involved. And because the techniques for assisted reproductive technology is getting a lot better, some medications, sometimes injections, sometimes doing things in test tubes and putting it back inside, and taking stuff out of places and putting them, and then creating it and putting it back inside. Because of all of that has exploded a bit more. It is still a bit more in the private sector, I would say, but it's just getting a little bit more and more able, like, for people to access. And so that's why we're seeing, if you ever see someone who's having a child at 50, not that I see that often, because there's other issues, but assisted.
Just to add on to Dr. Lisa's statement, yes, women can have children up to about 60. I've seen the oldest woman that I've cared for was 56. But in saying that, it is not common. And as we talked about the physiology behind eggs and the quality of eggs, and as we mature in life, from 35 onwards, the amount and also the quality of the eggs do decrease, and it starts declining slowly from 35. 40, it drops. And so the general advice out there is, if you are trying to have a baby naturally, your best window of period would be ideally before 40. The problem at the moment is, I wouldn't say a problem, but it is becoming a trend or a common in developed countries, is the ability of younger women to take their career pathway first and decide to settle down with children later. So when, as Lisa said, even though the natural decline in the number of eggs that you have drops significantly from year to year or decade to decade, the quality of the egg is different. And so that brings a very important topic. Even though you are going through your perimenopausal phase, which is from about 45 to 51, the average age here in Australia, it does not mean that you cannot fall pregnant. So you still need to consider taking some form of contraception if you are wanting to avoid any pregnancy. And the same goes between women who are between their 50 and 55, particularly if they have low egg volumes, but they've got good quality eggs. And so all you need is one good quality egg and one good quality sperm, and off you go with the baby.
Wow, very nicely explained there, Dr. Tema. Very nice. Dr. Luke, you want to add any information to that after Tema? Yeah.
I was just saying, making babies is that simple. Just one good egg or one good sperm.
Wow. Yeah, no, thank you so much, Dr. Lisa, Dr. Tem, for your response. And also, Dr. Luke, thank you for helping us, for reminding us about the beauty of breathing. Yeah, and just the technique that you allowed us to go through, really allowed us to, to be intentional. I think that's been like a very wonderful word I've been using lately, to myself, being intentional in everything that I do. And it's bringing in so many positive things, in everything that we do, I think, humans. So thank you for that. Things that we take for granted, breathing, you just breathe, as you wake up, or even when you're sleeping, you don't think about it. But thank you again for that, Dr. Luke, for reminding us about that. And that's, how it's connected to our mental health and our emotions. I haven't seen any other comments, but there's still people sitting here looking and listening. And I think many of them are in awe, if that's how I can say, because I have to say, to all of you, having a session like this, it's rare. And I just hope that this will continue, on. I can see some comments. Dr. Temba, can you see the comments on the chat? It's,
Just hide this maybe, and then click on it.
Malia has got a question on depression.
Common symptom of menopause, is that an additional? Yes, Malia, your question is very valid. Yes, in one of my slides before, I did talk about mood swings and low mood that's associated with menopause. And if this is not taken care of, it can lead to a decline and eventually lead to depression. So the physiology behind it is that the thought is the estrogen declining in estrogen levels. These almost always has a negative feedback into the brain. And so the part of the brain, as Lisa was talking about before, that releases, hormones that gives you a good feeling, the dopamine side of things, that's also triggered by estrogen. That's why we need it every day as part of our daily living, because it helps with bone health, with cardiovascular health, with genital urinary health, as well as mental health, the cognition. So if your estrogen levels is down, naturally you will feel low in terms of your mood. So some of the things that can trigger or help is, in addition to the treatment that we talked about before, the other added treatment, as Luke has already described in his lifestyle or the CBT therapy, is the mindfulness, relaxation techniques that'll bring anxiety levels down, that'll also ultimately help with depression. And the treatment for depression, which is, or other forms of treatment that's related to mental health issues such as SSRI or SNRIs, which was those medication I was talking about before. And we can also prescribe antidepressants for those women who are in the most severe forms that are not coping at all with their menopausal symptoms. Lisa, is there anything that you'd like to add? Or Dr. Letty?
I would just mention, although you mentioned that having a low mood may be a common thing, I would still say we described a lot of symptoms, but not everyone gets these symptoms. So there's like going to be many who say, what, menopause? Who just breeze through it. So it's not going to be a given that you feel those effects. Just kind of like how people go and have babies, and some women just breeze through their labor and they say, what baby? Like, as in, that wasn't very difficult. And some people have the whole shebang and the whole works. So I would say it's the same thing. There's things that are common, but there's lots who just don't get a lot of the symptoms, and some get mainly one thing.
Yeah. Just a quick comment. Sorry, I still can't work my video here. So, what I see in general practice is kind of like what Lisa is saying. Like, some women actually breeze through menopause, and some actually have a lot of issues. And mental health is definitely an issue in the sense that they usually have a lot of other things going on in their lives that they're juggling, and that tends to actually have an effect on their mental health. So yeah, I mean, there's a lot of obviously treatments and things out there, and a lot of pathways. And obviously, in general practice, if we have reached the end of our bag of tricks, then we refer to Dr. Tema and Dr. Lisa, so or Dr. Luke. Now that I know there's a whole lot of other holistic stuff. Thank you, Dr. Luke.
I just want to add as well, I think another component is to do, with the mind and mental health is understanding you as an individual and a person. I think this day and age, we live our lives, and it's so easy during our youth and when our body is, going through its normal functions just to exist. We go to work, we hang out with our friends, and we don't really take these moments to stop and go within and, go on your own life journey, if that's a spiritual journey, a physical journey, or just getting to know yourself. So usually the first point where people start, going within is actually when their bodies let themselves down. I don't know if you guys have ever noticed when you've been unwell, been sick, or been in hospital, all you have is that time with yourself and your mind. And that for some people can be quite confronting. So, when you are going through the natural aging process, and in Chinese medicine, they talk about things just slowing down, that circle of life. You're gonna want to resist it. So sometimes, the mood and the mind, it might not be clinical depression, it might just be change. And I think we see change as a thing to resist. But we can be actually empowered by this. And, if you spend your life, being a bit more mindful, and, even if that's just taking a walk a day outside and, looking up at the sun, looking at the stars, and just being alone with your own thoughts and your own feelings, and just say to yourself, hey, I'm okay. But also sharing those feelings with other people is so important.
Thank you, Luke. We just have, we can take one more question if that's okay, because we have a meeting after this. So the question that I have here, I can see on the chat box is, can we use combination MHT with SSRI or SNRI if the patient experience partially resolving the symptoms with MHT alone? I would love to hear what the others in the panel think, but my thoughts towards this question is, it's very symptom dependent. So if you have, more shared, this is your question. If you have a patient that has, it depends on the symptoms. So if she's coming in with mood symptoms, for example, it depends on how severe the mood is. And as Letty had already said, 20% of these patients would be asymptomatic, 40% will have symptoms, and then the other 20% will have severe symptoms. So if they are there because of mood symptoms and you've given or the MHT, and the MHT has not resolved their symptoms, yes, there's a role in SNRI, SRI. I give both as part of their treatment, just to make sure you are providing a full coverage. You're looking after their mental health, you're covering their, you're replacing their estrogen if it is safe to do so, and also I provide them the whole package of, these are your accessible avenues of accessing, yoga, remedial programs, all of these things, which are nutrition, which will eventually come together to a completed treatment care for your menopausal symptoms, rather than just take the script, go away and think about what you're going to do next. Naka.
Wow. Thank you so much. Vinakavaka Levu, to all of our wonderful doctors who have been so generous with their knowledge and time. And for those of you who are watching online, you can see that they've left the contacts on the screen. So please take a photo of it. It's got some very important information. Yeah, so please record it. And also there's some questions that has been coming in. For those of you who would like to see the recording of this, yes, it is recorded, and I will download it, and then I will share it with the team, with Oceania Pacific Health Association, and we'll be able to disperse it and share it as widely as possible. It'll also be up on my YouTube channel, and also with the Oceania Pacific Health Association website. So again, from all of us, Dr. Tema, Dr. Luke, Dr. Lisa, and also thinking of Dr. Michael and Dr. Quinileti, from all of us listening in tonight, Vinakavakalevu from the bottom of our hearts. Thank you.
Naka, good night.
Mother, take care.
Mother's bye.
Bye. Oh, wow.
So good.
This is so awesome. Now I can't go to
Listen,
sleep.
Letty.
I'm
See
gonna
you
say,
soon, right? Yeah.
Mother, Dr. Tema, Mother, Dr.
See you
Katie.
soon.
Bye.
And Lisa, I'm sorry it's so late for you in California. Thank you so much. We'll be in touch.
Yes.
Yeah.
Nakatao.
Okay.
Nakatao
Nakatao.
ka.
Yeah.
Nakamade. Wow. Thank you to everybody who've been listening. Really appreciate it. And as we were saying, if you have any other questions, please feel free to send me a message. I'll be happy to send it over to Dr. Tema. Okay, so it's been wonderful, such a wonderful evening of just learning and sharing. Dr. Tema Rasoki Windus is from Wunimbau in Serua, and it's been an amazing journey. We met digitally, online, last December when I organized a panel of our medical doctors that deals with women's health, and what a blessing! So through my niece, Dr. Lavinia Vangi, she introduced me to Dr. Tema, and now this series is going to be continuing in the next couple of months or so. So I will talk to them and see what are the topics that Oceania Pacific Health Association would like to share with the rest of the world. And I'm just so honored that they requested for this Talanoa and webinar to be here on this very humble Talanoa with Dr. T program. I'm logging in here from the United States of America. It's 1:30 in the morning on Wednesday, and I'm still awake, and my brain is so energized that I had a book. I especially got a book with a pen, and I was just writing furiously, taking notes, just like I was, still in high school. I'm just so much a huge fan of Dr. Tema Rasoki Windas and her amazing team, Dr. Mike Burling, Dr. Lisa, Dr. Luke, and Dr. Queenie Letty. And all of these doctors, they have connections to the Pacific, right? And we are so blessed that they can take their time away to be here with us and to share this information freely. And I want all of you who are listening in tonight, please say a word of prayer, of thanksgiving to all these amazing doctors who took their time away from their busy schedule. Look, they're going for another meeting, and another doctor is actually in the surgery, in the theater right now. And whew, I'm just so, so thankful. And again, for everybody that has been on this journey with me on Talanoa with Dr. T. I'm just so moved that this program can provide all this information for the benefit of our Pacific people. Pacific people in the region, but also our Pacific people in the diaspora, our Pacific people in Australia, in New Zealand, in Europe, here in the US, and also in the Middle East. There's so many of you that are listening in, and we are just so thankful that we can all sit here together and learn together. And hopefully, that all this information, we can be able to touch someone's life that we can save, someone's life that we can extend a little bit longer in order for us to encourage each other to be proactive. Let's be proactive, ladies and our sisters and our moms. So one of the lessons that I learned today is that if there's any abnormality that you may face, in going through in your body, don't sit there and think about what should I do next week, right? Or what should I do? Or who should I wait for? Do something now. We've got the phone numbers there. And please reach out to me and Dr. Tema if you are scared to go and see one of the specialists. All these doctors that were here today, they will be happy to provide assistance to you and give advice and tell you what to do. Okay, so don't be scared. Remember, whatever that you're going through, there's always help out there. You just have to speak to someone. You just have to look to your right. You can look to your left. Everybody has their phone. You can go online and Google it, type it down, and start reading with some of the information that are online. Many of us are using ChatGPT. A lot of us are using AI, artificial intelligence. A lot of information are there online, ladies and gentlemen. Go online. This information that we're sharing tonight are not only for women, also for our men. Okay, because even for me, where I'm currently connecting in from California, as I'm looking over across the Pacific Ocean, I'm seeing a lot of our young people dying at a very young age. And one of the reasons why I'm looking at why it is happening is that many of us, we procrastinate, right? We procrastinate thinking that, oh, this thing that is happening in me will just disappear, right? It'll just go out of its, on its own. Maybe in some situation that might happen, but in some other situations, you have to do something about it. Go and see your family doctor. Go and see your nurse. Ask someone in the medical field. And that way, they can be able to guide you to go to the place where you can be able to get treatment. If the surgery is needed to be done, they will advise you on what to do. Okay? So, whew, thank you again for everyone who are here. I just got a message from one of my colleagues that the time wasn't long enough. You're absolutely right. As I said earlier, we will be back. I will talk to our colleagues at the Oceania Pacific Health Association if we could schedule another session, whether it'll be to do with menopause, whether it's to do with men's health, and any other topic that they're interested to share with us, and even cancer. Cancer should be a session on its own because there's so much that we can, unpack within the discussion of cancer. And so, again, my appreciation to all of you who are still listening in, Vinaka Vakalevu. And those of you who are asking for the recording of this, yes, you will find this recording on my page. Talano with Dr. T, please follow my page. I have a YouTube channel. I also have all on the socials. I'm on TikTok, Instagram, and Facebook. And also, I have a YouTube channel. So please follow, and I will look forward to see you again in the next session. I'm just so, so thankful. Vinaka Vakalevu, Fafitai Telelava, Malo Alpito, Mahalo Nui. Thank you, Tomas. You all have a very good evening, and I will see you at my next Talano session. Vinaka Vakalevu and Isang Wadamata.